Many of you might not have heard of functional medicine and how it differs from traditional medicine. So on today's segment, we'd really like to talk about what the difference is between the two. Functional medicine is when we have the opportunity to really dig deep into each individual organ system and how they all function together as a whole system. For example, how does the thyroid influence the gut, influence your metabolism, and then influence those famous bowel movements that we all don't like to talk about? All of this is so important for us to look at in functional medicine. Versus traditional medicine is typically out to treat the symptom. I like to use the example of a domino effect. In functional medicine, we're actually looking for the first domino that fell. In traditional medicine, you're typically treating the symptoms that are a result of the last domino that fell. There is a small difference between functional medicine and holistic medicine. Typically, holistic medicine is primarily reserved only for herbs and nutraceuticals. Functional medicine allows you to incorporate pharmaceutical treatment and nutraceutical treatment, which would be more natural treatment, whatever is the best or most appropriate treatment for the patient. Another example of how functional medicine works is in the category of weight loss. A lot of our patients come in here looking for their cause and how to treat their weight gain. What we look at here in our functional medicine example is looking for the first domino that created that weight gain or that inability to lose weight versus trying to treat the last domino in the scenario. What we like to do is thorough, comprehensive testing to determine that physiological cause. Once we can determine it, we can treat it, and then the patient is free to lose the weight because the body is under, that stress has been removed and the body's no longer under it anymore. Some stresses in the body that can cause weight gain are thyroid problems, adrenal gland dysfunction, GI problems, fatigue, stress, and of course anything that has to do with the body having to work overtime, such as in diabetes that we see all the time, or an autoimmune condition. At Mederi Health, we help with a malfunctioning thyroid much like we would approach any functional medicine case, looking for the root cause. And then we use a combination of nutraceuticals, herbs, and sometimes pharmaceutical regimens to get that thyroid back to its highest functioning ability. Once that thyroid is corrected, a lot of the symptoms that go along with thyroid problems, such as hair, weight problems, metabolism issues, and mood, become corrected. Nutraceuticals, for those that don't know, are basically pharmacy-grade supplements. They've been approved to be sold only in doctors' offices, and they're typically a higher grade and higher quality and faster efficiency. Another common symptom that people come and present with here at Mederi Health is depression. And we also attack that by looking at the different causes from depression. We obviously do a thorough and complete analysis of the adrenals because they have a lot to do with your mood, as well as your gut, because your gut can play a huge role in your depression. Once we clean those areas out, then we then determine if there's a true chemical imbalance. If there is, we typically refer to one of our specialists here at Mederi Health to take over this case, or we continue with a very holistic, manageable regimen, get you back on track to a healthy lifestyle.
I had absolutely no energy. My body hurt all the time. I was extremely fatigued. It was an effort to get out of bed. You know, to get dressed, to try and think about what I was going to do, or if to do anything was almost impossible. I had to psych myself up to function. We worked on that. We worked on getting things clean, rebuilding the health of my digestive system, and that's going to take a while. But my God, the difference is night and day. My energy level is much higher. My body is working better. My digestive system is working much better. I'm not in chronic pain in my abdominal region anymore. My depression is so much better, and my blood sugars are phenomenal.
A lot of people ask me why I've made functional medicine my passion and everything that I do in this office, and it's because of the patients that leave here every day after their visits. It's challenging, don't get me wrong, and functional medicine is not for every case that comes through here, but when it works, which it does most of the time when we have these thorough testing and we can come to the root cause, it changes people's lives. And when I get a hug at the end of the visit and I have tears in people's eyes, that's what brings me to work every single day, and that's why I love doing what I do.